I really wish I would have known my first time around what I know now about preparing for Zometa and what to expect, because I feel like my first time around really hit me like a ton of bricks, and now I just go in and it's easy peasy lemon squeezy. I know what to expect, I know how to prepare, so I'm going to share with you today a little bit about that. So for those of you that don't know what Zometa is, Zometa is used for like treating your bones. Maybe if you have like osteoporosis, or if you're a cancer patient and need to strengthen those bones. Overall, it takes like the calcium and the minerals and stuff throughout your body, and it just uses them in a way to strengthen your bones. I am not a doctor. That's just kind of like what my nurse broke it down to me in like very simple terms. But again, it is used to keep your bones strong and to strengthen your bones. For me, I am on it because I'm a metastatic breast cancer survivor, and I am on it every 3 months. A lot of people do it every 6 months, but the reason why I do it every 3 months is because I had bone mets. So my cancer had moved into the neck part of my spine. So that is the reason why I'm on it. And anyways, let's go ahead and get into it. So what to expect and how to prepare. So before you go in, you want to make sure that you drink a ton of water. Okay, drink a lot of water. The first time that I went in, I did not know because nobody told me. And then I get there and the lady's like, have you been hydrating? And I'm like, no, I was at work all day. Some of you may know, like, I am a teacher, so I was not drinking a lot of water throughout my day. Anyways, so you want to drink a lot of water. This does help a lot. I don't know why it helps, but it helps so much. And then also what I do prior to about, I would say an hour before, I take a couple Tylenol, just because some people get the side effects of like fever and like flushness. For me, my first time around, I got the fever, I got the fatigue, I felt like I had the flu. And some people get that, not everybody. Some people don't have any symptoms at all, but really for me, they said that a small, tiny bit of the population of people, which I'm so special, was me, you get the flu-like symptoms. So basically for me, I was like, okay, how do I prepare like I were to have a flu? So now I go in, I take a couple Tylenol before I go in, about an hour before. Stay hydrated from the day before, okay? Even the day before, and then the morning of, drink like a ton of water as well. So then once you go in, they're gonna hook you up to this like infusion IV, right? So this is my lovely picture of the last time that I went. All right, and I like to get comfortable. You know, I feel like sometimes with infusions and stuff, it just gives you anxiety. Maybe not everybody. If you are totally good with them, then kudos to you. But for me, sometimes I feel like comfort is important just in general with my entire experience. So I have them bring me a warm blanket. I have them bring me pillows. I put my feet up and I just sit and relax. And it'll take you about like 30 minutes to get through the whole thing, because they've got to sit there and do a saline flush first. And then once they do the saline flush, then they'll do the Zometa. The Zometa itself, the drip, only takes about 15 to 20 minutes depending. Mine tends to get like stuck sometimes, so it takes me about the 20 minutes. But some people do it in like 15 minutes. They're in and out and it's really quick. But overall, it doesn't hurt or anything like that while you're taking the Zometa. You don't really have any symptoms right away. It just feels like a regular IV. When you're sitting there, you don't feel anything. You know, you obviously have the needle in your arm and you can feel it's a little cold, which is why that they might give you a blanket, but that's just because room temperature things are going into your body, and your body is not room temperature, your body is warm, so your body is going to end up cooling down, which that is with any IV that you get. So yeah, other than that, One of the things that the nurse said to me this time around that I didn't know prior as well, and this is my 6th time going in, so she gave me some advice about some people take allergy medicine like a Zyrtec right after so that it can help hinder your side effects. Now, I have never done that before. I always just will take my nausea medicine just in case, because I mean, I'm like always nauseous, and then I'll take some more Tylenol, you know, a few hours after, and I'll continue to take the Tylenol so that it'll keep the side effects at bay. Because really my main side effect now, if I do all of these things of staying hydrated, you know, taking the Tylenol and making sure that I'm resting, it really only makes me fatigue, and I will get the hot flushes, but then again, I'm also on hormone treatment, so I don't know if the hot flushes are related to my hot flashes and they're just causing them to become more prevalent, I guess, or if it's actually from the Zometa, because I do get frequent hot flashes in general just from my other treatment, but I do know that it like exacerbates that, or it gives me more of them. And I do feel like the nighttime I get more hot because I'm probably going a longer time without taking the Tylenol. But overall, I would say if I do those things, like take my Tylenol, drink a lot of water, overall, those 2 things in itself, if there's anything that you can do those 2 things. And then if you're still experiencing symptoms, take the Zyrtec like the nurse had said, and you should be totally fine. But other than that, thank you all for watching and keeping along with my journey. Stay tuned and I will keep everybody updated. Thanks.